TAs. I hope you guys are doing good. So today we will talk about um, the developing brain, development and aging, okay? Specifically as it relates to the brain, the nervous system. So here is our outline today: prenatal, postnatal, and aging nervous system. So before you are born, prenatal development. The nervous system actually begins developing 18 days after the egg is fertilized. The neural plate develops first. It then folds in half to create a neural groove. That neural groove then deepens until the edges of it touch, and it begins creating a hollow space known as the neural tube. That's usually present by day 21. The edges are eventually pinched off to form the neural crest, and the neural tube and the neural crest form the nervous system. This is very important in development for this whole process to go as planned. And if it does not go right, it can create a lot of congenital defects. So the neural tube development, so the cervical region develops first. It's as if the middle of the tube closes, and then it zips up, and then it zips down. So the middle portion closes, and then it closes on the way up, and then it closes on the way down. It kind of zips up towards the brain and then down towards the sacrum. If this goes awry, some of the things that can happen is anencephaly, which is the brain doesn't develop because the neural tube did not close at the top, or spina bifida, where it did not close at the bottom, and that could cause defects with the legs. It could cause paralysis. It could cause a wide variety of different effects depending on how severe it is. Typically, the neural tube is closed within 24 days of pregnancy. That's less than 4 weeks. That's the point where most people don't even know they haven't missed a period yet. They don't even know they're pregnant. And all of this is already happening. So that's why it's really key, if you are trying to become pregnant, to be careful what you're consuming, that you're taking your vitamins, that you're not drinking or to doing any drugs or anything like that, because you could affect the baby before you even know you're pregnant. Another thing as far as vitamins go is folic acid is one of the most key vitamins in decreasing neural tube defects, so keeping you from having a child who develops spina bifida or anencephaly. And a lot of people cannot break down that, and so a lot of times they have to take a broken down version already. So that's something that you may want to look into if you're trying to get pregnant, because that is key in helping the neural tube develop. Here are just some of the sad situations that can go wrong if the neural tube does not fully develop or close, if it doesn't fully close. So that anencephaly we talked about, we'll talk about spina bifida, and there's a wide gamut of other ailments that could happen. With spina bifida occulta, all that is just the vertebral arches, or the bones themselves, have not completely formed. So the spinal cord is still in the spinal column. There's no bulge outside of the skin. There's no nerves escaping the spinal cord or the column where it's supposed to travel in. It's just that the bones themselves have not fully developed there, and it's a sign that the neural tube did have some issues with closing. With meningocele, those bones obviously did not develop, but they have allowed a sac full of cerebrospinal fluid to protrude and push out of the skin. So one of the pictures here, where if you see the top right and the bottom right, those kind of show where there is like a cyst where it's projecting out of the skin. So if none of the nerves are in that cyst and it's just cerebrospinal fluid, it's called meningocele. Myelomeningocele is where part of the spinal cord is protruding outside of the spinal column in that bulge. And so both of them would require surgery to fix, but this one would be a very dire situation where surgery needs to be performed very soon after birth, to correct that so that the nerves don't get damaged, aren't exposed to the air, and the child can continue developing. I actually have a cousin who, his wife found out while she was pregnant that their child had spina bifida, and they did two different surgeries in utero. Like while she was pregnant, they somehow put instruments in there and did surgeries to correct the spina bifida while she was pregnant, which is so wild and so amazing that they can do that. But they did help correct the issue. So that is evidently an option as well that I didn't know about. I don't know how long that's been available, but pretty cool work. So here is a slide showing thoracic spina bifida occulta with hydrocephaly. So they have the swelling in the brain and also the portion of the spinal cord that is projecting outwards outside of the body. So again, that would require surgery, and the sooner the better for the developing baby. All right, with the brain and spinal cord development, starting day 28 of gestation, the neural tube subdivides into the brain, midbrain, and hindbrain. The forebrain separates into the cerebral hemispheres and the thalamus and hypothalamus. The midbrain pretty much stays the midbrain, which is always easy. The hindbrain develops into the pons, cerebellum, and the medulla oblongata. The inferior portion of the neural tube becomes the spinal cord. And so here's some pictures on different days, 3 weeks of gestation, 7 weeks, and 11 weeks, and how much development has occurred in the nervous system at that point. All right, so with the neural crest, it travels throughout the body and actually becomes the autonomic nervous system, the somatosensory receptors, the adrenal medulla, and the Schwann cells. In the picture, it has several of those listed, but one that it has listed that I didn't mention is melanocytes. These are just special cells in the skin, in the hair, and in the eyes that produce and distribute the pigment. So they kind of determine your eye color, your hair color, your skin color. So all of these cells distribute and differentiate into different parts of the nervous system. One fun fact, by 12 weeks of gestation, so that means you are only 3 months pregnant, still by the end of the first trimester, the basic structure of the nervous system is already set. The glial cells continue to multiply after birth, but most neurons do not. So most neurons have already finished multiplying by the time a child is born. Only the hippocampus and the olfactory epithelium form new neurons throughout their life. So while you're growing and aging and developing, the only areas that can form new neurons is the hippocampus and the olfactory epithelium. So smell, and then the hippocampus. Here's a few just key cell processes. Mitosis, that is cell division. Migration, this is when neurons move to their proper location. Differentiation, once they get to their location, they acquire a specific structure and function. For example, dorsal neurons become sensory neurons, more ventral neurons become more motor neurons, and then myelination happens where they're surrounded by the myelin to increase the speed of transmission of action potentials. How some of this stuff happens, there are chemicals that attract and repel neurons to lead them to the correct place. Failure for the neurons to migrate to the right place could actually cause abnormal generation of action potentials, which could cause the child to have seizures. That's one reason why it could be common for younger children to have seizures and possibly even grow out of them. Neuron differentiation is controlled by chemical cues and the location of the neurons. Failure for the neurons to differentiate causes abnormalities, and some of these abnormalities could be those seen in Down syndrome or seen in fetal alcohol syndrome. Typically, myelination actually starts around 20 weeks of gestation and is mostly complete by age 2. So some areas, mainly the prefrontal cortex, so remember that's the front of your brain um, where your critical thinking, your logical thinking, your planning ahead, and some of those areas are housed. That doesn't fully myelinate until early adulthood. Most of the others are completely myelinated by age 2, but the frontal lobe, the prefrontal cortex, does not fully myelinate until adulthood. This is one reason why they don't want people who aren't adults yet drinking or smoking or having tattoos or making long-term decisions when they don't have the long-term processing part of their brain fully developed. All right, with postnatal, sorry, better than a sneeze, maybe. Postnatal development. At birth, we have more neurons than we do at adulthood. So the neurons that fail to form synapses are actually pruned. So they are basically killed and absorbed by the body. Synaptogenesis is the process of synapse formation, and life experiences cause certain synapses to fire more often, and then they develop new and stronger pathways. Proper stimulation through sensory and motor input or movement is required for proper synaptogenesis. So, neurons without strong connections are eliminated. So, if you want your child to be advanced in reading, then you need to read to them a lot and they need to practice reading. If you want them to be advanced in motor skills, they need to practice that. Uh, the um, saying practice makes perfect. Practice makes your neurons and your synapses fire more often, so the pathways are stronger, and so you become better at that. And the ones you're not using, you really do lose. So there is some accuracy and some truth to the statement: if you don't use it, you lose it, even in brain development. Critical periods. So these are stages where the synapses are created in large numbers in certain functional regions of the central nervous system. If those areas are not stimulated during the critical periods, then it will result in poor function of those systems. So the brain's ability to establish synapses in regions where the critical period was missed declines after that critical period ends, which makes it hard to develop that portion of the brain later in life. So there are some critical periods of time when it's most important to learn specific developmental tasks and opportunities to have those presented, or you may not develop them well. With myelination in a full-term baby, the following are already myelinated at birth: sensory neurons, cranial nerves for smell, taste, sucking, and swallowing. The optic nerves and the motor pathways are not fully myelinated at birth, and premature babies may not actually have fully myelinated neurons for sucking, swallowing, or smell, which could cause feeding issues. So that's one reason why it's so common for premature babies to have issues with feeding. They're not fully myelinated. All right, the brain doubles in size during the first year of life. 50% of the baby's energy goes to brain development, which is pretty awesome. Myelination of most neurons is complete by birth. However, myelination of sensory and motor cortex is complete by 16 months of age, so a year and 4 months. So pretty soon after birth, myelination of those areas are complete. But remember, the prefrontal cortex does not completely myelinate until adulthood. Again, the hippocampus and olfactory epithelium continue to divide after birth, and other neurons don't divide after birth, even if they continue to myelinate after birth. So don't get confused with that. As earlier we said, those are the hippocampus and olfactory epithelium are the only cells that continue to divide after birth. However, some of the neurons continue to myelinate after birth. So, don't get too confused there. Developmental disorders, these can be genetic, they can be environmental. Some of the causes are infection, premature birth, oxygen deprivation to the brain, and many, many more. Many of the disorders don't have known causes. So, a lot of times when I was working in pediatrics, we would have a patient that their diagnosis said unspecified developmental disorder or unspecified genetic disorder. That was common for us to see in patients that just didn't fit a true diagnosis for a certain thing, but still obviously were missing developmental milestones and maybe having some cognitive issues. Cerebral palsy. This is a non-progressive motor disorder, and it can occur prenatally, during birth, or shortly after a child is born. Typically, the causes are similar to what we saw with the developmental disorders: an infection, a lack of oxygen to the brain, could be a hemorrhage in the brain, could be premature birth, it could be some type of brain injury. I have seen more often recently. While working in pediatrics, children who are diagnosed with strokes during utero. So they'll say, during this trimester, the child had a stroke in this area, and that's what caused the deficits. So that's really interesting. I don't know if our technology is just getting better to be able to diagnose those a little bit more specifically, or if they're happening more often. I hope that's not the case, but it's just something that I heard about a lot more recently that you didn't hear a lot of back in the day. But also, there were a lot of kids that went into the category of cerebral palsy that didn't have any clear defining reason why. And so maybe we're just able to learn why a little bit more now. But um, cerebral palsy is always classified by their motor dysfunction, even if they have issues with sensation, with speech, with cognition. Um, we determine the type of cerebral palsy they have based on their motor dysfunction. So here are some of the types. There is spastic cerebral palsy, which involves damage to the upper motor neuron. Remember, that's the brain and spinal cord. Typically, the corticospinal tracts on one side of the brain are affected, which causes spastic hemiplegia or paralysis on the opposite side of the body. It could not be paralysis, it could be weakness. It could be hemiparesis weakness on that side of the body, just depending on the amount of damage. Athetoid cerebral palsy is characterized by slow, writhing movements of limbs due to damage to the basal ganglia. So if you look at this picture, it says spastic cerebral palsy and dyskinetic and ataxic and mixed. The dyskinetic actually includes this athetoid cerebral palsy, which is characterized by the slow writhing movements, and it also includes dystonia, which is characterized by more twisting type of movements. So the dyskinetic cerebral palsy is more of an umbrella term that has the athetoid and dystonia under that term. Ataxic cerebral palsy is related to uncoordinated movements because of damage to the cerebellum. And then mixed means there are two or more dysfunctions present at the same time. Some of the symptoms of cerebral palsy include speech disorders, sensory impairments, hearing and visual problems, seizures, cognitive dysfunction, and musculoskeletal impairments. Arnold-Chiari malformation. So this is a malformation of the hindbrain where the medulla and the cerebellum actually protrude down through the foramen magnum. Remember, that's that big hole at the bottom of your skull into the spinal canal. So some of the symptoms can be headaches, ataxia, weakness of the face, tongue, dizziness, and hearing loss. Type 2 Arnold-Chiari malformation is related to blockage of the cerebrospinal fluid, which causes swelling in the brain, and then the brain matter pushes that area down into the spinal cord. So typically, type 2 is accompanied by spina bifida. And so those are two diagnoses that you often see together. Hydrocephalus. This is a blockage of the cerebral spinal flow through the ventricles and the subarachnoid space. So could this cause Arnold-Chiari formation, malformation? Maybe. Sometimes. Most of the time what happens is that the child's skull bones are actually, they're not yet fused. Remember, we have that soft spot, and our bones of our skull don't start out fused because they want to expand so our brain can grow. And so, as the ventricles expand, the cerebral cortex and the skull expands, and the bones of the cranium thin, and they can become paper thin, very thin, and very likely to get damaged. And that's if it happens in a young brain. Of course, by the time we reach adulthood and well before that, our bones have already fused. So if there is swelling in the brain during adulthood, there's nowhere for it to go. And so it just smushes the brain matter and causes the brain damage and cell death to anything that's squished long enough, unless somebody goes in and decreases that pressure to the brain. So some of the causes, so hydrocephalus causes significant swelling of the head. It may be accompanied by spinal bifida. It could be accompanied by Arnold-Chiari malformation. It could be a result of a head injury or of a tumor or of scar tissue in the brain. Typically, to decrease the amount of swelling, they will implant a shunt directly into the ventricles of the brain, and then that shunt will actually run down under the skin. It will run down into the belly, like not the stomach, but just like the area where your organs are, and dump that fluid, and it gets reabsorbed and removed by the body. So one thing to notice and to pay attention to is children who have the shunt um, may have great results and never have any issues, but at some point the shunt could get blocked, like the tubing could get kinked like a water hose and not allow it to drain properly. There are various ways that it could get blocked. And so if you start noticing a change in a child, like they're getting more aggressive or lethargic, or a bulging soft spot if it's a younger child, or um, they're complaining of a lot of headaches or vision problems, or anything abnormal, and they have a VP shunt, I would certainly alert somebody to check the shunt to make sure that they are not now experiencing more swelling in the brain because the shunt has dysfunction. So just pay close attention to that. That could be a ER situation very quickly if it's not taken care of. All right, Down syndrome, most people have heard of. This is the genetic disorder caused by an extra copy of the 21st chromosome. So it's called trisomy 21 because there are 3 chromosomes on the 21st chromosome. Um, these people who have Down syndrome, you typically have smaller brains, fewer cortical neurons, abnormally formed dendrites, undifferentiated cells, and difficulty forming synapses. So that's 5 different ailments with just the central nervous system, just their ability to develop the neurons and connections in the brain. Brain abnormalities, physical characteristics, cognitive disabilities, and low tone are some of the symptoms of Down syndrome. And interestingly enough, the nerve cells, when looked at under a microscope, actually look like the nerve cells of people who have Alzheimer's disease. And Alzheimer's is a very common thing later in life for people who do have Down syndrome. So this can have a great effect on their ability to develop. Autism, it was previously known as pervasive developmental disorder. It is kind of a spectrum disorder, meaning that people can be very high functioning Low functioning, it has a wide range of symptoms and presentations based on the person. Someone could have severe impairments, or they could be highly intelligent and highly functional. So now you typically hear it referred to as autism spectrum disorder. Previously, there was autism and Asperger's, and they kind of differentiated different things. But now it's all kind of under the umbrella of autism spectrum disorder. It is a neurodevelopmental genetic disorder. They typically have more neurons in the cerebral cortices, but less in the cerebellum, which is so interesting because a lot of um, people with autism are like overstimulated. It's hard for them to like block out background noise or block out. And so the fact that they have more neurons in their cerebral cortices to me makes so much sense as to why they're overstimulated. Like they're getting too much input all the time. And that can make it hard to learn. You know, if you were in an environment where there was like a horn honking and a kid chewing gum right next to you and somebody tapping a beat on the desks beside of you and somebody in front of you just jumping around and you were trying to read a book, it'd be really hard to absorb that information. So when your brain can't actually um, block out some of the input to focus on what you're trying to do, that's very difficult setup for learning. So um, some of the symptoms that you commonly see in people who have autism are difficulty with social interactions, picking up social cues, and understanding how to act in certain situations, difficulty with communication. They may or may not have difficulty with cognition. Um, some of the early signs might be that they line up toys versus doing like make believe type play with their toys. They prefer to play alone. They have sensitivity to loud noises. They avoid eye contact. Maybe have aversions to touching, like they don't like to be hugged or not real cuddly at all. So there's a lot of different symptoms and it presents differently in different children or adults who have it. Um, One thing they have found is that people who have autism make less serotonin. And so sometimes they will treat autism with serotonin reuptake inhibitors. That's what the SSRI is, which could help them have more social functioning or possibly, be able to learn better in their environment. Another common symptom is also repetitive behaviors, doing the same thing over and over, maybe watching the same little portion of a video over and over, or saying the same thing over and over, or singing or listening to the same song over and over, or doing the same hand movement over and over. So that's also a very common sign in children with autism. We're going to switch gears. So now we're talking about the aging brain. After 30 years of age, the brain shrinks about 0.8% every year. So that's bad news for us in our 30s. We're getting dumber every day. Every day. You see, I'm already getting dumber. I can't even say it. Only 10% of the neurons are lost with age, typically over the lifespan. Less neurotransmitters are present during aging. There's fewer synapses. The postsynaptic receptors and dendrites also decrease over time with aging. There's typically increased cholesterol in the brain, which makes older neurons more stiff and respond less to sensory stimulation. The blood flow to the brain also declines by 23% from age 30 to age 61. So because of that decreased blood flow, the brain actually needs to extract more oxygen from the brain with age in order to still function. Sensory receptors become less sensitive with age because the action potential threshold actually increases with age. Some of the lower motor neurons in the brainstem and spinal cord are also lost with age. So there's a lot of bad things that happen with age. I don't like it. It's not just wrinkles and gray hair, it's also loss of brain matter. So, big deal. I know there have been studies that look at stimulating the brain and continuing to learn and read and challenge yourself over your lifetime, leading to people being more sharp, and able to recall things more readily as they age, but I don't know if it affects the amount of neurons lost or not. So that would be a great study that we may never be able to do because we can't really do some of the tests without unless somebody dies. So we just don't know all these things. Effects of aging on the nervous system. So muscle atrophy and less precise control of movement, decreased sensitivity, slower processing speed, decreased neuroplasticity. All of this happens with age. So you really excited to get old? You've got this coming for you. One thing to note is changes in power have a greater effect than changes in muscle strength because power has a speed component. So a person may be strong enough to catch themselves when they're falling, but not have the speed to do it in time to keep from falling. So this is one reason why older people are more likely to fall, more likely to get certain injuries because of the decrease in power, specifically in the speed of the movements that they're trying to do. All right, let me know if you have any questions. Thank you for uh, listening, and I will see you on the next lecture.